All right. Hello, everybody. Dr. Rafich here from Vet Triage. Hopefully you can hear me. I'm in a hotel lounge and it's a little bit noisy in the background, so hopefully it's not too distracting. I did miss the last couple of days because of traveling for conferences, so we are back and hopefully I can keep coming here once a day to do this. We are going through this issue of JAVMA. There it is. And May 15, 2018 is the issue. We're looking at this paper, Characterization of Subclinical Bacteria, Bacterial Cystitis, and Pyelonephritis in Dogs with Chronic Kidney Disease. The objective is to determine the prevalence of bacteria, which is defined as a positive microbial culture for at least one urine sample in dogs with chronic kidney disease, and characterize the findings of subclinical bacteria, bacterial cystitis, and pyelonephritis. It was 182 dogs between 2010 and 2015. Results: 18% of dogs and 17% of urine samples had positive cultures. 45% of samples were found for dogs with subclinical bacterial urea, followed by dogs with pyelonephritis at 40%, and then 15% for cystitis. E. coli was the most common. It was 73% of cultures, and the stage of kidney disease was not associated with the presence of bacteria or any specific diagnosis. So, in conclusion, the prevalence of positive urine culture in dogs with kidney disease is lower than reported for dogs with some systemic disease that may predispose them to infection. So let's go into the introduction. The prevalence of UTIs, that's urinary tract infections, in healthy dogs is 27%. Subclinical bacteria in healthy dogs has been found between 2% and 9%. Occasionally, occult UTIs, so urinary tract infections, based on quantitative urine microbial culture results, can occur to be positive regardless of the presence of symptoms. And we usually term that bacterial cystitis, but which can be characterized by dysuria. So dysuria, dysuria, it's just abnormal urination. Polacuria is frequent urination, and then urgency to urinate, as well as finding bacteria in the urine. Except for pregnant women or people undergoing invasive urologic procedures, treatment is not recommended for human patients with subclinical bacteria, even if they are immunosuppressed or are kidney transplant recipients. Diabetes mellitus and hyperadrenocorticism is associated with a 37 to 46% prevalence of positive cultures for positive results for microbial culture of urine samples in dogs. 95% with a positive urine culture result lack clinical signs of bacterial cystitis. The prevalence of positive urine culture results in cats with chronic kidney disease has reported to be 17 to 22%. And again, these cats lack clinical signs of urinary tract infection. So now we go into the materials and methods. A couple of points here. They define stage 1 chronic kidney disease as being non-azotemic. So azotemia is defined as an elevation in nitrogenous substances in the blood, and we characterize it typically from blood work looking at the creatinine and the BUN, blood urea nitrogen levels. So azotemia usually has to include those two things. So for stage 1 chronic kidney disease, non-azotemic animals, but they have renal concentration defects, renal proteinuria, or persistent increasing serum creatinine combined with minimal concentrated urine, meaning a urine specific gravity of less than 0.030. Stage 2 through 4 are diagnosed based on the level of serum creatinine concentration after correcting for any hypovolemia or dehydration. Animals were excluded if they had endocrine disease, if they had urinary stones, urinary incontinence, bladder cancer, if they had a nidus for infection like a ureteral stent or a subcutaneous ureteral bypass, and patients receiving immunosuppressive drugs orally or by injection were also excluded. They define a positive urine culture in quantitative testing if there's over 1,000 colony-forming units of bacteria per ml of urine. and it's considered a positive culture. So they had three categories of dogs: subclinical bacterial disease, pyelonephritis, and bacterial cystitis. Subclinical included those with body temperature that was normal. It didn't have any signs of urinary issues. They had a blood leukocyte count and a leukogram that were within reference range, including the absence of bands and neutrophilic toxic changes. They had no evidence of azotemia that was progressive, and they had no azotemia that was progressive that failed to improve despite antibiotic treatment. And they also negative results obtained 14 days or more after initiation of antimicrobial therapy. They didn't have any cylinderuria. So cylinderuria means that there's um, um, renal casts in the urine, and casts are basically like an impression of the inside of the kidney. It means that cells are sloughing off and dying. Absence of ultrasound findings of pyelonephritis. So bacterial cystitis, which is the second category, include the same criteria as subclinical, except those patients had dysuria. And then pyelonephritis, they had a fever, they had signs of pain on renal palpation, they had high white blood cell count, high neutrophils, they had low neutrophils as well, high or low neutrophils. They had bands, or they had at least 1+ toxic change to the neutrophils. They may have cylinderuria, with the exception of hyaline cast, which is a type of cast, newly diagnosed renal tubular glucosuria, progressive azotemia that improves with appropriate antibiotics, and follow-up culture indicates negative culture within 14 days or thereafter treatment with antibiotics. And they also had, of course, abdominal ultrasound that was suggestive of pyelonephritis. Ultrasound findings consistent with pyelonephritis include renal pelvis dilation, echogenic debris in the renal pelvis, hyperechoic line in the wall of the renal pelvis, renal megaly, retroperitoneal effusion, hyperechoic fat adjacent to the kidney, increased echogenicity of the renal parenchyma relative to that of the liver and spleen, focal hyper or hypoechoic cortical lesions, not consistent with the cyst, infarct, cancer, or other non-infectious process. Those are all good rules of thumb if you're looking at what signs on ultrasound to look for pyelonephritis. Results. Cultures were positive in 17% of urine samples. That makes a prevalence of 18.1% for at least one positive culture result. The most frequent retrospectively determined diagnosis was subclinical bacterial infection, which is 45% of cultures, then pyelonephritis at 40%, and then bacterial cystitis at 15%. There was no significant association between the IRIS. The IRIS stage is, I forget the acronym, but that's the group that determines the stage of kidney disease for animal patients. And there was also no significant association with diagnosis category. The number of positive culture results, regardless of patient diagnosis, was also not significant amongst the IRIS stages. E. coli was the most common bacteria found. That's 73% of cultures from 76% of dogs. All patients received antimicrobials. They were treated for 2 to 6 weeks. Dogs with subclinical had no change in the urination habits. I mean, they didn't have any urination habit changes to begin with. Recovery of renal function following completion of antibiotic treatment varied amongst the patients, with improvements in serum creatinine ranging from 0% to 37.9%. Okay, discussion. In this population of dogs with chronic kidney disease, the prevalence of bacteria in the urine based on at least one positive urine sample culture was 18.1%, and most often was subclinical. The IRIS-CKD stage was not associated with the frequency of diagnosis of subclinical pyelonephritis or cystitis. The most common bacteria was E. coli in 73% of samples. The prevalence of a positive urine culture from dogs with chronic kidney disease in the present study, less than reported for other systemic diseases like diabetes and Cushing's disease, but greater than that observed for healthy dogs. The prevalence of a positive culture results for dogs with chronic kidney disease. Sorry, I lost my place here. The prevalence of positive culture results for dogs with chronic kidney disease in our study was similar to that reported elsewhere for cats, which is 17% with kidney disease. In that study, 23% of urine samples were positive. However, 72% of cats with positive culture results in that study were identified as having occult urinary tract infections, So probably subclinical bacterial infection. Another study found 22% of cats with kidney disease had positive urine cultures, with most having no clinical signs of UTI. So they want to differentiate here that if you're going to call something a dog or cat with UTI, it means they not only have a positive culture, but also have signs of urinary disease. Whereas subclinicals, bacterial infection, they are not considering it a UTI. They're saying that's subclinical because there's no clinical signs. The authors of some studies in human and veterinary medicine have defined subclinical as the presence of the same bacterial species identified in serial urine cultures from patients without signs of infection. Positive growth from 2 urine samples is recommended for diagnosing bacteriuria in women to help exclude growth resulting from extra urinary tract contamination, whereas one culture was sufficient for men. In another study, E. coli was most common in urine cultures as well, with dogs with pyelonephritis. Other studies have shown with subclinical disease that E. coli and staph pseudo were most common. Others have shown Proteus mirabilis and Staphylococcus aureus. Chronic kidney disease has not been found to be a risk factor for the development of UTI in cats. UTI has not been found to be a variable that influences the progression of chronic kidney disease in cats. The authors have suggested that antimicrobial treatment may not be indicated for dogs with subclinical disease. Renal disease may be considered a disease that compromises normal defense mechanisms against UTI. It's been hypothesized that compromised host defenses may prevent the development of clinical signs. So what they're saying is if you have kidney disease, that means potentially you're predisposed to having a low defense mechanism to protect against to fight against bacterial infection, which means if you can't fight against bacterial infection, then you don't have all the signs of inflammation and urinary urgency, dysuria. That's a pretty interesting hypothesis there. However, one study found that dogs with isostinuria is not a risk factor for development of UTI in cats with systemic disease. And another study found that performing a urine culture based on isostinuria in dogs is not cost effective. Recommendations from human infectious disease experts include not treating patients with asymptomatic bacteria in the urine, with specific exceptions such as pregnant women and people undergoing invasive urologic procedures. Asymptomatic bacteria in the urine are not associated with the progression of kidney disease in people with chronic kidney disease. So, an antibiotic treatment given to renal transplant recipients with subclinical disease was associated with a 2.8-fold increase in the risks for developing a clinical UTI. If treatment for subclinical disease is not indicated, the data for this population of dogs in the present study would suggest that only 9.4% of submitted urine cultures warranted antimicrobial treatment. However, all the dogs received antimicrobial treatment in this study. The absence of lethargy, signs of renal pain, and cylinderuria does not rule out pyelonephritis. Similarly, lack of expected ultrasound findings does not rule out pyelonephritis either. Having a subclinical disease in this study might have developed clinical signs of bacterial cystitis or pyelonephritis if antimicrobials were not given. Because all cases of bacteria in the urine were treated in this manner based on culture susceptibility results, patients with azotemia that failed to improve despite resolution of the bacteria were classified as having subclinical with progressive chronic kidney disease instead of having pyelonephritis. So it's an interesting study. Yeah, I always advocate urine culture test. I mean, not necessarily they don't have clinical signs because you may not treat that anyway. And why would you check if there's no clinical signs typically, unless you're screening for something? But if you're going to submit a urine analysis, you always submit a urine culture. I don't care if there's no white blood cells or blood or bacteria in the urine sample, in the urine analysis, always submit a urine culture. If not for this reason alone in this paper, you can diagnose the presence of bacteria, and then decide what you want to do with that, with the conversation with the pet owner. And also gives you a foundation for showing that the urine culture was negative or it was positive with this bug or whatever it is, but always submit a urine culture with your analysis. And also I recommend submitting a urine analysis to the lab too. I wouldn't do it in-house. The laboratory is so good at it, and it's just not worth it you don't need answers right then and there. If you want to do it for a quick scan of like urine specific gravity, is there glucose in the urine, is there bacteria, white blood cells, or blood, or whatever, that's fine. But I would always submit the urinalysis to the lab. All right, everybody, thanks so much for watching. I'll hopefully be back tomorrow with another one. Take care.